Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome to the Stem Cell Healing Institute podcast, video podcast. And we are here with Dr. Zahra Figueredo. How are you, doctor?
Very good, Louise. How are you on this lovely Friday afternoon?
Oh, I'm doing great. Not looking forward for the traffic though. So we do have an interesting topic today, which is going to be rheumatoid arthritis. And I wanted to ask you, what exactly is rheumatoid arthritis?
Rheumatoid arthritis is it's an autoimmune condition, meaning that we have our immune system creates antibodies that attack our own tissues. Auto meaning self, and autoimmune meaning our immune system is attacking the cells of our own body. Now, rheumatoid arthritis can be primary or secondary to a primary disease condition. For instance, a lot of times rheumatoid arthritis can be caused by lupus, for instance, or it can be part of the lupus picture and fall under that umbrella. Or it can just be a standalone or a primary condition where for whatever reason our antibodies are created and attack the joints of our tissues, the cartilage in our tissues. So that's specifically what rheumatoid arthritis is.
Okay, and why is the stem cell treatment, should I say, better than the traditional treatment?
Right. Yes, it's a very, very important question to address, because we need to understand that most of the autoimmune conditions, especially, lupus and rheumatoid arthritis and multiple sclerosis, and a lot of the autoimmune conditions are addressed conventionally with immunosuppressive medications like steroids and other medications that all they do is they cover up the symptoms by suppressing those antibodies that are attacking our cells and not really addressing the root cause of the disease. In this case, being the immune system. And why is the immune system oury in the sense that what happened? What happened to cause the body to attack itself? And a lot of times there is no real clear answer. But it is really important for patients to understand, and for people in general to understand, that autoimmune conditions very often can be caused by genetics, or it can be caused by some other chronic disease that you wouldn't even consider perhaps a chronic cold. For people that get sick very often, or something that like an unresolved infection of some sort, can cause the immune system to sort of, it can affect the hardwire of the autoimmune system to start just out of nowhere spontaneously produce antibodies against our own tissues. And so this is what is occurring in many cases. So what we do with stem cells is that we address the inflammation, we address the immune system specifically, in order to go back in time and undo these antibodies and sort of modulate the immune system to start working correctly. And that's what we can accomplish with the stem cells, which conventional medicine does not do.
I see, doctor. And do you apply these stem cells directly into the joints, or do you do it IV?
Louise, that is a very, very important question again, because in this case, what we want to do is we're actually going to do it in 3 different deployments. And what that means is that we will apply the stem cells, yes, locally, right at the joints, because the joints are not very vascular. There's a very low, if any, blood supply to the joints. So if we applied the stem cells intravenously right into the blood, we wouldn't get them to the joints very effectively. So it's really important that we apply them directly to the joints, which means locally. We will also apply the stem cells intravenously in order to get to everywhere the blood flows, in order to address any kind of damage that may be or may have occurred to any other organs and tissues. As well as, and this is really important, because this is an autoimmune condition, we want to get the stem cells right to the immune system. And that means we will apply the stem cells to the lymph nodes as well. And we just, again, leaving no stones unturned. And the immune system begins in the lymph system. So we want to get the stem cells directly into the lymph nodes as well.
That's right. Doctor, and what will be like the improvements that we will feel after the stem cell treatment? How can we notice the difference?
Yes, we see diminished pain almost right off the bat. That is so important because most patients that come are in so much pain. They're on some sort of painkiller or steroids. We diminish or eliminate the need for painkillers and steroids. We can get patients in remission within 3 months in many cases, as well as we're trying to do two things, Louise, when we're dealing with autoimmune conditions. It's really important that we accomplish these two things. One is we want to halt the progression of the disease. Okay, so there has been damage done to the cartilage of the joints, which means that we can see conditions where there's bone on bone, or just diminished cartilage to where just walking or normal activity can be so painful. So we want to halt the disease progression, number one. Number two, we want to undo the damage that's already been done. Okay, that means regenerating the cartilage, regenerating the joints, diminishing pain. Again, so we're addressing the autoimmunity in number one, and we're addressing the damage that's been done in number two. So these are the two things that we want to accomplish, that we very successfully do accomplish in most cases very, very, very well.
So is this a one-time treatment, or does the patient have to come again to get a second shot of stem cells?
We have never had to see a rheumatoid arthritis patient twice.
Oh, wow. They can do it just in one trip?
In one trip with very good results. We have seen, again, a diminished need or an elimination of the medications, as well as an indefinite halt of the progression of the disease. So that's really important. And I think what makes us so successful in our approach, and I don't actually think this, I know this, is that we use a very, very high and very effective number of stem cells, which is super, super important in the joints. So using a really high number of viable, living, non-toxic, very potent, brand new stem cells that we create in the body. We have a proprietary method of growing and producing these stem cells right in the body. So we don't even have to do it in a lab. So that's number one. And then our pre and post-treatment approach, which I'm sure a lot of our listeners have heard already, with our pre-treatment of detoxification, as well as growth hormone treatment, stem cell enhancement formula, as well as the oxygen therapy that we do, which is all in preparation of the body as well as preparation of the stem cells. And we use more than one type of stem cells in many cases. So we get the best of all the worlds. Endometrial stem cells in this case with autoimmune conditions is super, super important, because those tend to work really, really effectively with not only the inflammation, but with autoimmune conditions. So it's important that we combine these, and we don't know of any other clinic that uses endometrial stem cells, which are very safe and effective adult mesenchymal stem cells in this treatment, along with the rest of our cocktail, our proprietary cocktail of stem cell deployment.
And this might be a stupid question, but I'm gonna ask anyway because
Your questions are never stupid, Luis. Ask away.
But I was wondering if Stem Cell Healing Institute uses stem cells from any other animal source or person.
That's a very, very good question. We do not use embryonic stem cells, which is really
Okay.
important to point out. As listeners and viewers have probably heard in past podcasts and videos, embryonic tends to be it's not proven safe. Okay. It can cause tumors, it can cause cancers, uncontrolled growths, because they're such a primitive cell. They're so low in the cell line that they're undifferentiated, so they can produce any cell in the body, which is a good thing. However, because they cannot be controlled in how long they live and how long they regenerate tissues, it's just not, we haven't found a way to use them effectively, so we don't use them. However, the only stem cells we do use are adult mesenchymal stem cells that, yes, they can come from another source other than the patient's own body if we need to. In the case of endometrial stem cells, they come from a female, obviously female's uterus. Only females do have uterus, which we know that. Which have been proven very, very safe and effective in treating, as I mentioned, inflammatory conditions, as well as autoimmune conditions. And we also do use umbilical cord cells, but we find our proprietary bone marrow stem cell growth measures to be very, very effective and safer and cost effective for patients as well.
And from animals, never ever, right?
Never from animals. No, right. We don't find the need to do that.
All right. And last question, doctor, is everyone a candidate to receive stem cells?
You know, Louise, thank you for asking that question, because no, not everyone is a candidate for stem cell treatment. If a patient has an active cancer, that is our biggest
no. Our biggest no.
Exactly. It's not likely that an adult mesenchymal stem cell can activate or provoke a cancer. However, we just don't want to take any chances in that case. So if there is an active cancer, we will not allow or permit the use of stem cells for that patient. Now, having said that, if there is a patient that is in complete remission and all of the cancer markers have been addressed and the screening has been done and we've done our due diligence and they are approved in that sense for stem cell treatment, absolutely, we will consider them as a candidate.
Okay. I don't know if you have anything else, doctor, to add to this podcast.
Louise, I think we've covered a lot of ground here. And maybe just to reiterate and mention that this condition or this treatment is done in Guatemala. It has to be done outside of the jurisdiction of North America. And
may I ask you why?
Yes.
Since we are on the topic.
Yes, and that is because these types of particular treatments where stem cells are combined with other factors such as growth factors, created into a cocktail, the stem cells are grown or manipulated in any way. These types of things are not allowed in the US or Canada. No stem cell treatment is allowed in Canada for that matter. And so these measures make stem cell treatment so much more effective for a patient. And so this is why we don't do this in North America, and we have to do it in Guatemala. And Guatemala also allows us to keep this treatment very cost effective and very ethically priced. So if you do your due diligence, you'll see that we include a lot to get the best possible results for a very ethical price. So And we're very, very happy and proud to be able to offer that.
All right. Thank you, doctor. I appreciate your time and the time you take to record these videos. And hopefully I will see you next week.
Yes, thank you so much, Luis. It's a pleasure.
You take care, doctor.
You too.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.